Hi everyone, happy Wednesday evening. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And we are in stress management boot camp tonight talking about detoxification. So I'm gonna hop right in. As always, let me know if you're watching live, give me a thumbs up. Let me know that we're good with audio visual. If you're watching the replay, let me know when, let me know the time so that I'm aware of what works best for everybody so that you're getting the information that you need. If there's a topic that you want to know about, send me a private message. Hey Sandy, thanks for tuning in. If there's a question that you want to put out to the group and you want to do it in an anonymous fashion, feel free to send me that as a message as well. And I'm happy to post that so that you can get some feedback. As always, this group is for you. It helps keep me semi-sane. I was able to put Parker to bed at like 7 o'clock tonight, so I've already done a radio interview, got a little bit of work done, ate a warm meal, which usually doesn't happen, and now we're talking detox. So hello everybody tuning in. Awesome. So let's talk about what detoxification is. And we're going to discuss how this plays into our immune function, which is extremely important right now, as well as our stress management, which is why everybody's here. So the word detox has two common meanings, obviously, to either withdrawal from a toxicant, could be alcohol, could be drugs, could be a prescription medication, to which someone has obviously developed an addiction, or it is the body's physiological process of rendering chemicals, compounds, hormones, and toxicants less harmful. And that's what we want, because every day, as you're going to learn in the next couple minutes, we are exposed to an extreme number of toxins, some of them by choice and some of them not, and we need to know how to get them out of our system. So the second definition is the one that we as functional medicine physicians utilize. So when we say detoxing, that's typically what we're referring to. And we want to make sure that our metabolic detoxification is working as well as it can. It will vary based on genes, as you're going to learn. It will vary based on experiences, and it will vary based on the amount of toxicant and the frequency that you are exposed. The organs of detoxification work efficiently as a whole to reduce the body burden and toxic load of chemicals. They include the liver, the kidneys, the intestines, your lymphatic system, and your sweat glands. So all of those are organs of elimination when we're discussing detoxification. So there's two phases of detoxification. When we teach this, the way that we're doing right now, when I'm not allowed or able currently to show you visuals, the phases of detoxification happen in two parts. So the first phase of detoxification, if you can think of a suitcase where we are attaching that handle to the suitcase, that suitcase being your toxin. So phase one detoxification is literally just the process of sticking a handle on a toxin. Now phase two detoxification is grabbing that handle with now the toxin attached and literally taking out the trash, getting it out of the system. So that is phase one and phase two detoxification. So if you're ever on Jeopardy, make sure that you remember you learned it here. A person's toxic body burden is a result of three main factors. First, the toxin exposure. So again, that can be internal and external sources. Secondly is a person's genetic predisposition to the ability to detoxify. And there are a lot of different genes that play a role in that. There's a few popular SNPs right now, and everybody and their mother wants to say that they have XYZ SNP and they have to do this because of that. And I'll tell you that from a functional medicine perspective, knowing that you just have one SNP, it's good, but it doesn't paint the whole picture because everything in the body works together. So you could have one SNP that's deficient and you could have 5 that are taking over for that one. So that one that's not really doing its job, it's okay because the other guys are handling the burden. And vice versa. So make sure if you're working with someone that's doing a genetic analysis that they're looking at you at the whole picture, not just telling you one little SNP. So their predisposition to effectively detoxify enzymes for processing the compounds is unique and will depend on familial influence. And then finally, the integration of proper nutrition and ongoing dietary ingestion like we talked, what you're eating and how you're supplementing is key to every single dietary process. It's not just about how you look in your genes, so to speak. It will impact the body's capacity to appropriately reduce the presence of toxicants and lower the body burden. So how are we burdened? And because everybody's at home and your schedules have changed, maybe you have a little bit more time to reflect on what you're exposed to on an ongoing basis, because everything from how you travel to your job, what your job is. I have I have very good friends that are hairdressers, and that for most of them, nowadays there are a few that do less toxic chemicals, so they have a decreased burden. But being a hairdresser from, let's say, the 70s through the last probably 10 years, some of the most toxic job that you could possibly have. If you think of straighteners, if you think of perms, if you think of the color, if you think of the fumes, literally just hairspray and all of the chemicals that they're just exposed to literally 24/7 and have on their hands, it's just a toxic soup. So give your hairdresser props the next time that you see them, and make sure that they're detoxifying appropriately. So how are we burdened? Every day our organs work together in order to get the toxins that we're exposed to out of our system. It's a continual process. It doesn't stop. So that's why you want to give some of those organs a break periodically and do a very good deliberate detox, so that you can allow that system to rest and work as well as it can. So toxic bacteria, pollutants, plastics, heavy metals, all of those things that we're exposed to 24/7. I was looking to see if I had anything around I could show you. But anything, again, if you're going to the store, everything is wrapped in plastic. It is packaged again in plastic. We use plastic. A lot of people use plastic storage at home. And all of that will leach into your system. If you're still using a microwave, please do not microwave your plastic. I don't care if it says it's microwave safe. Please don't do it. If you think of your warm, like your coffee cup, and you have a warm liquid and it is becoming a gas and it's hitting the top of that coffee cup and it's becoming a liquid again and it's taking the toxins from the coffee lid back into your coffee, that is just a soup. So that's some of the everyday exposure that we get to some of these toxins. Through exposures commonly occur through ingestion or inhalation of food, water, air, and from time spent in these different environments, like we were just saying. In other words, everyone is continuously living amongst muck that is going to perpetuate these problems. So that's why we need to be deliberate in decreasing our body burden. Scientists estimate that the average adult carries within their body at least 700 toxins, and a newborn's body can contain over 200. And that's very, very scary. When I was pregnant, I was very deliberate in what I was eating, what I was exposed to, so that I could do my best to minimize that for Parker. And then obviously during the time that I was breastfeeding, the same goes, because that can continue through breast milk. So you want to be really careful if you have young kids, what they are exposed to as well as yourself. So what is an environmental toxicant? It is an agent that is able to cause a harmful response in humans and animals. Again, it can be found in food, air, water, soil, our medications, supplements even. It can cause a number of medical problems, or it can exacerbate things and make them worse. So, if we are in the northern Chicago suburbs where there's a company that is sterilizing plastics with chemicals. And there are a lot of individuals that are up in arms about this, and rightfully so. But the toxins in the air in Lake County are just one thing that we're exposed to. So it is my hope that these individuals are just as concerned about the toxins in their children's water, the toxins, in their children's food. There's, in my opinion, there is no sense in being up in arms about the air that you're breathing and then driving your children through McDonald's and, making them more toxic. But again, some people, you choose your poison, but that's just my personal opinion. So a handful of samples of these the one I just mentioned, lead in old pipes, of course, mercury in seafood, in vaccines, in dental amalgams. And please, please, if you have thought about getting your amalgams removed, do your research. I did that. I had them removed before I knew as much as I know right now. And it is exceedingly dangerous to have them removed and have your cavities refilled with a white amalgam so that it looks the same. The individuals doing that, if your dentist doesn't look like they're coming out of a hazmat situation where they're literally completely masked and gowned, and you are gowned and you have oxygen, then you need to be going somewhere else to have those amalgams removed, because that is a very, very serious and toxic thing that you're doing when you're removing that metal from your mouth. So just be careful. If you want more information on that, if you're thinking about it, let me know. There are a few environmental dentists in the area that do it. But again, it's a very, very serious process, so be careful. PCBs, of course, pesticides, cigarette smoke, different medications, BPA, which is in water bottles, it's in plastic toys. What else? Fire retardants. So of course, that's important, but you want to be careful because it's sprayed on your mattresses. It's especially in children's clothing. So you want to watch out for some of those sources. Mold, of course. Genetically modified foods. This is a very touchy subject for a lot of people. My feeling is we should not be eating GMOs. Maybe we'll do a video on that in the future. Personal hygiene products and cleaning supplies. Again, I talked about candles the other night. I do not do candles anymore. I do essential oils now, but you want to be really careful what you're breathing in. If that's still your thing, be exceedingly diligent in what is used in the candle. And personal hygiene products. I switched over all of my makeup a few years ago to more natural products. We use Beauty Counter at the office. And I like it, is it as dramatic as when I wore MAC or Chanel? Absolutely not. But it also doesn't have all of the chemicals in it. And again, I choose my poison, I get my eyelashes done, having glue on my eyes all the time. Probably not the safest thing in the entire world, but that's the only thing that I put on my skin, that is going to be toxic. I use natural hair products, natural makeup, natural skin products. So I feel like I'm erring on the side of caution when it comes to that. In 2009, the EWG conducted a pioneering study testing the umbilical cord blood of 10 babies for toxic chemicals. And remember, even if you don't have kids, the reason that we discuss these things is because that baby was once you. So you can, understand where you're coming from and how, if you have the foundation of not having the greatest health history, it may have started with some of these antecedents that you didn't have control over. So now that now it's time to do the detoxing and to limit the impact it's having on your health. So in all of these 10 babies that were tested, the test found more than 230 industrial pollutants across the 10 samples. Among those were the cord blood of every one of the 10 newborns were lead, mercury, and PCBs. And that's in our water now. And you have to think how people are throwing away their medications. I don't take prescriptions, knock on wood. But, the average adult takes anywhere from 3 to 15, depending on the age and the comorbidities that are being treated. Now, if somebody doesn't finish those medications and they get thrown out, where do you think they end up? They end up in our water. So essentially, a lot of us are on SSRIs if you're not drinking filtered water, whether you like it or not. So you want to be really careful what's in your water. Again, I'm seeing a lot of mold and in my functional medicine patients. So I have patients that are being, and I don't like the word treated, but are seeking treatment for everything from RA to allergies, food sensitivities, difficulty concentrating, issues with focus, generalized pain, fibromyalgia. And a lot of that can actually be traced back to a mold sensitivity. So it's important, you can have your house tested, you can have your water tested. So when you're looking for these toxins, make sure that you're not only treating yourself and your family, but you're also testing your home, because there's no point in undergoing, a detox and treating yourself for mold and then putting yourself back in the same situation that colonized the mold in the first place. So you need to make sure you get to the root cause of this. Some symptoms of toxicity can include everything from dehydration, constipation. If you're constipated, you're not going to be able to get those toxins out of your system. So having 2 to 3 bowel movements a day is super important. Nobody wants to talk about poop. It's one of my favorite topics. Everybody poops. And it is so important to get rid of these toxins in your system. Having stress, what else will impact, your ability to clear some of these toxins? Lack of physical activity. So moving is so key, especially now. You're stuck in your home. You're out of sorts of your normal habits. So get up and move. Be deliberate. Do 10 burpees an hour, if you're feeling adventurous. A lack of restorative sleep is going to impact our toxic burden. And then some other symptoms can include everything from weight gain and obesity to infertility, which again, we see quite frequently in our clinic. Allergies, skin rashes, fatigue, brain fog, headaches, gas and bloating, all of that. Food plays a very large role in your ability to detox. We talked about diet plans and meal plans the other night, and some of the specific diets that I give patients, even some of our meal plans, include what I call, like power foods, and those will help your ability to detox. Identifying toxic foods also is very important, and minimizing or eliminating those altogether is the way to go. But if you're aware of toxic foods and eating as clean as you can, we went over the Clean 15 and the Dirty Dozen the other night. If you haven't seen that video, there's a handout on that. It's downloadable. I would say take a screenshot with your camera and have that so that when you're shopping, you can refer back and forth and you know what you need to be buying organic. That would be the Dirty Dozen. Those are the ones that are sprayed most heavily and do contain the most toxins. And then the Clean 15 are the ones that you don't really need to worry about because they test negative the majority of the time. The remaining steps in detoxification, what food has to do with that, is how our body metabolizes toxins. And the bulk of this occurs in the liver during that phase 1, which is sticking the handle on. And phase 2 is actually removing that toxin altogether. Once the liver has transferred these toxins into water-soluble metabolites and you're able to eliminate them, that's what we're looking for. Then they get excreted by the kidneys, the intestines, and the skin, of course. So I often tell clients, if you're having anything, any breakouts, anything related to the skin, eczema, skin allergies, you want to take a look at the gut. There's something that is not happy in the gut. It's not necessarily just environmental. It's not necessarily outside in, but it could be inside out. So if anything's going out with the skin and you're thinking that it's your detergent or an allergy, or your kids were playing in the weeds and they have a sensitivity to something, take a look at what's going on in the gut as well. So what can you do to reduce exposure from toxins? Eat a well-balanced, clean diet so that your body can properly eliminate toxins. You want to minimize what's going in and maximize what you're able to get out. Drink filtered water in glass or stainless steel bottles. If it is well water, you want to test your well every 2 years. If it's city water, I would recommend, we do testing, a lot of different testing in our office, and we can order kits so that you can test your water at home and see what's in there. See if there's fluoride that you want to be getting out. See if there's some of these heavy metals. Take a look at what you're consuming all the time. Practice good oral hygiene, brush and floss. And reduce sugar consumption to limit the need for fillings. Biologically safe dentists are very important. Make sure you trust your dentist and that they're not over prescribing different treatments that need to be done. If you vaccinate, ask your physician about delaying the schedule or using thimerosal-free vaccines. And again, this is a hot topic for a lot of people. And it's important to know and to ask questions. So you should know what's in your vaccine. Do you need to space them out? If you have a child with sensitivities, or you yourself as an adult, if you are getting vaccines, if you're getting boosters, knowing the impact that has on you and your family is super important. And again, you have options. So know that you can not do them. You can spread them out. You can delay them. A child's blood-brain barrier and their gut are exceedingly leaky, probably through age 12. So if you're able to delay some of their early childhood vaccines, you may be doing them a service in the long run and not inflaming the brain, not causing some of that gut sensitivity that we see so often in kids, allergies, eczema, asthma, all of those things. So just know that you have choices, you have options. Eliminate cigarette smoke, of course. If you're still smoking, I don't know what to say. Put it away. There are alternatives. Air fresheners and perfume. I haven't worn perfume in years. I don't even know. And I own it, but I haven't worn perfume in years. And there's no need for air fresheners. There are an infinite number of oil companies out there that have infinite scents. So buy yourself a diffuser, buy some high quality oil. Again, I'm a fan of Young Living. If you have questions, send me a message. But that's the way to go. This morning I was doing some combination, again, this like goddess combination of something. And at the office, I really like lemon, lavender, and there's another one I put in there. It'll come to me. Supposed to smell like spring. So that's what we're diffusing at the office. Switch to toxin-free hygiene products. Take a look at ewg.org. They will list what products are safe, what products you want to be staying away from because they do cause cancer. They are toxic to the system. Just be aware of that. And use safe cookware and storage containers. So as far as detoxing the body versus your home, I have a whole list of things to do for your body. So eat organic, make sure you're well hydrated, sweat, use a sauna. We have a spare room in our basement. I have no idea what we're going to do with it. I'm considering buying a sauna. Fingers crossed. But that's one of the best things that you can do to detox. And if you don't have access to a sauna in your home, quite a few gyms do, and there's a handful of places, opening up that offer that as an added service. So take a look into using a sauna. Deep breathing is huge. We want to clear out the lungs, especially with what's going on right now. It is a virus that attacks the lungs and has very serious implications for those that do not have good cardiovascular health. So you want to improve that, improve your breathing. Switch out your hygiene products or make your own. That's an option. Dry brushing. I will tell you that I bought a dry brush. I did not use it consistently. If this resonates with you and you want to be dry brushing, you want to start at your feet and dry brush up towards the heart. Same with the arms. Start out and dry brush in. That helps to stimulate the lymphatic system. Oil pulling is good. If you have heard of this or want to do this, you can Google it. There's instructions. I would recommend using sesame oil if you're going to be doing that. Do not swallow the oil. So you swish oil in your mouth and spit it out. Do not swallow it. Avoid antibacterial soaps. Have positive thinking. Set boundaries. So if there's individuals, and of course now if you're quarantined at home and you're quarantined with someone that is not a positive individual, was Chris, I like to tell us to play a 15-minute guided meditation. Oh, that's awesome. That's a great way to go to sleep. I like that. Do your guided meditations. Read ingredient labels. Be educated. There's really no excuse now. You can't plead ignorance anymore. There's a lot of available information. So take a look at what's going on and know what they mean. Ways to detox your home. Choose stainless steel, cast iron, or glassware for your kitchen. I'm trying to replace, I still have some plastic ware I was great when Parker was a baby, and everything that I stored for him was in glass and in stainless steel, and he has a little lunch and everything in little stainless steel pieces. But for us, I was a little lazier, so I'm still transferring some of that over to glassware, but that's a great option for you. Use DIY cleaners. Again, Young Living does like a thieves cleaner, and you can buy a small container and then make your own and even add different scents to it. Turn off your Wi-Fi from all your devices when not in use. Install a smart meter guide if applicable, and a lot you may know that we now have smart meters on our homes, and that's so that the companies don't have to come out and read the meters anymore. It automatically sends them the data, but that also transmits quite a bit of radiation. Charge and store your cell phones away from your bedroom. Again, we're talking about the fire retardants, buying organic mattress covers and sheets, and filtering your water is super important. And this is even important, and a lot of people forget about this. You can buy filters for your shower. You can buy whole home filters. Say that 3 times fast. Because if you think of this, if you're somebody that takes a bath and you're filtering your drinking water, that's awesome. But then if you're taking baths quite often and you're sitting in water that's not filtered, then your body's absorbing all those chemicals. So you may as well get a whole home filter, and then you're able to circumvent some of those to begin with. So are there any other suggestions that anybody has besides Christy as far as what you're doing at home to detox, or questions when it comes to detoxification? We can discuss those as well. We offer an awesome detox at the office. Jade is sort of the champion of this, but you know, it's a cleanse. It's a 6-day thing. It includes a detoxification protein powder, a probiotic, a drops liquid that actually pulls the toxins out of the system, and what's the last one? A binder, so that helps to, once the toxins are freed, like we talked with part 1, then part 2 is actually eliminating them. So it's awesome. Patients have had incredible results with it. Again, I think it's 6 days, and we've had everybody lose from like 6 to 15 pounds in the 6 days. But again, then it's about what do you do after that. So I've had patients that celebrate by going out for a pizza. Not what I would recommend. But after you do 6 days of a detox, then your sugar cravings go down, the quality of your skin improves dramatically, you're allowing your gut to heal, you're probably not eating some of the things that you've had food sensitivities to, so stick with that good plan. Do you eat in the 6 days? Yes, Chris, you eat in the 6 days. Sold. Honestly, Monica, I don't know how much it is. I wasn't planning on talking about it tonight, so I didn't look it up. I want to, off the top of my head, I want to say, I don't even want to throw a number out because I'm not sure. I want to say it's like 175. Do you eat in the 6 days? Yes, you eat in the 6 days. Let's see if I can pull up what the meal plan looks like. Essentially, you're eating like a modified elimination diet. So if anybody remembers like the Slim Fast commercials that were a shake in the morning, a shake at night, and a healthy lunch, that's essentially what you're eating. Brooke, is detox safe while breastfeeding? No. Fabulous question. You do not want to do a detox if you are pregnant, thinking about becoming pregnant, or breastfeeding. And the reason is, you will free those toxins. So essentially, you know, you'll do phase 1 where you're putting the handle on the toxins. So you're freeing those toxins. And then when you go to eliminate them, then you will eliminate some through breast milk. So my recommendation is always to wait until after you're done breastfeeding. And for me, that was an extremely long time, 3 years. Long time to not be able to purposefully detox. So Erin, what you can do is you can eat clean, and that can be challenging depending on what your breastfeeding cravings are. You know, for me, being pregnant and breastfeeding, I wanted good fats, and that's good because your baby should be getting a lot of fat. So you know, doing something more on like the keto side where you're doing, yeah, exactly. It's like forever. Yeah, and the drainage drops. That's what I was referencing before. The drainage drops are terrific. So depending on what your cravings are, should you be having sugar? No, don't have sugar. It's not good for you. It's not good for the baby. It increases inflammation. But if you can stick with fat, and protein, then you may not be craving the sugar as much. So try to get in all those fruits and vegetables. Yeah, exactly. I'm just not a sugar person. For me, I would take alcohol over a piece of cake or anything. You know, Dr. Jade, it's all about carbs. So Jade would take like the bread over the wine. But again, everybody picks their poison. Is cleanse good to do if you're diabetic? Yes. So doing the cleanse, we've had fantastic, and I always say with the caveat, check with your physician. But it's great for balancing blood sugars. It's great for getting some of these toxins out. And depending on the type of diabetes that you have, I've had pre-diabetics and type 2 diabetics that have done this and actually been able to follow one of these programs and minimized their blood sugar fluctuations and actually eliminated the diagnosis. Thanks. Also makes so much more tired. I hated sweets during pregnancy. Yeah, so sugar is going to make you very tired. You're going to feel good for like a minute and then everything's going to drop off and you're not going to have that sustained energy. So do healthy fats. I loved avocados. I was eating avocado 24/7. Can Gianna do it? Yeah, Gianna could do it. There's probably enough, Christy, in one kit for the two of you to do it. I know we've had patients that have done it together before. You might need more probiotics though. But yeah, 2 people, you can buy one kit. I think the kit, like I said, I think the kits are like $175. And then I'll post it in the group, so stay tuned. And we also were doing a, if anybody downloaded the meal plan that I put together, the stress meal plan, stress relief meal plan, we did a detox plan. So if anybody buys the kit in the next week, I will email you the detoxification meal plan as well. It's awesome. Yeah, give her the probiotic complete. Yeah, the probiotics are incredible. And the probiotics are great this time, obviously, because you're trying to boost your immune system. And 80% of that immune system is coming from your gut. So they're seeing a lot of individuals with this virus that aren't doing very well, and they're attributing again to having darker skin, so you're having low vitamin D levels, having pre-existing cardiovascular conditions, and also having a depleted immune system because of poor gut health. So you know, we're going to talk more about gut this week. It's the foundation of everything. So what is the diet on the detox plan? It's a modified elimination diet. Ideally, again, you want to try to be eating organic. Meat, your meat options are pretty open. So poultry, lamb, rabbit, Christy, bison, venison, cold water fish, so sardines, salmon, trout, halibut, legumes, dried peas, beans, and lentils. So again, if you are eating like low FODMAP, if you are doing anything where you're staying away from peas, beans, and lentils, you don't want to be doing it during a detox, even though you can. So if you have a specific diet that you're following, you may continue that while incorporating the detox protein powder and things like that. Dairy products. So on this, they recommend unsweetened cultured coconut milk, milk substitutes, which is what I recommend anyway. And you can do vegan style rice cheese, if that's your thing. Starches, breads, and cereals. You can do sweet potatoes, yucca, taro, arrowroot, tapioca, millet, buckwheat, quinoa, brown rice. Again, beans and peas are allowed. And then vegetables. Okay, so all vegetables except those in the don't box. So I'll hit those real quick. Fresh, frozen. Cruciferous vegetables are fantastic, such as cabbage, broccoli, cauliflower, Brussels sprouts, turnip greens, kohlrabi. All of those are fantastic. What they don't recommend is doing canned vegetables, creamed vegetables, of course, vegetables prepared with cheese. Some of this should go without saying. Butter sauce or other types of sauce that are in the prohibited category. You don't want to do nightshades on this. And so that would include eggplants, peppers, potato, tomato, and tomatillo. Yucca in the air fryer's on. That's a good idea. I haven't done that. I'll try that. And then fruits. You can even do fruits while you're doing this. So preferably whole, fresh, unsweetened, preferably low glycemic, so berries, apples, plums, apricots. You do not want to do overly ripe fruits because that increases the glycemic load. So pineapples, raisins, very ripe bananas, dates, watermelons. You don't want to do highly allergic fruits, so those would be citrus or mango. And you don't want to do sulfite containing or canned fruits. Obviously, you don't want to be doing sweetened fruit drinks, jams, jellies, things like that. So this is all spelled out pretty well. There's beverages, there's fats, oils, and nuts, condiments, things like that. So we kind of go through. There's even some shake recipes that Jade put in here. So what it looks like is you would be doing a shake for breakfast, days 1 through 6, and then you would be doing a shake for a snack, days 3, 4, 5, and 6. And then other than that, you're doing your meals, and it is spelled out here pretty plainly how to take the vitamins, when to take the drops and things like that. It's an awesome program. And then there's also instructions on if you want to continue after the 6 days. Again, do you follow the detox meal plan that I provide, or do you want to do something else? Do you want to follow an elimination diet and see if you're having food sensitivities to different foods? There's lots of options. The only thing that we do recommend is if you're going to do a detox, that the 2 days before, you're very, very deliberate in making sure that you're having bowel movements. Because again, if you're freeing these toxins from your system, you want to make sure that you're getting them out. And normal is 2 to 3 bowel movements a day, and they should be like snakes. They should not be like rocks. If you need to take Metamucil, if you need to take any sort of additional fiber supplements, then we need to take a look at what's going on in your gut, because you probably need probiotics, you're probably dehydrated, you're probably not getting enough physical movement. And especially now, again, with the change in circumstance, I find that people are sitting even more than they were before. And those are things that will help you move. And food sensitivities can contribute to constipation, as can medications. So you want to make sure, again, before you're going to engage in any sort of detox, that you are having regular bowel movements. So that was everything I wanted to talk about this evening. If anybody has questions, let me know. Shoot your suggestions. I will put up details on the cleanse. I honestly didn't even think about pulling that up. I'm sort of throwing these together at the last minute, doing the best I can. So if there's topics you want to know about, let me know. Again, there's a wealth of random information up here, and I'm happy to teach so that you have something to work on these next few days while we are still in our stay at home. If you have questions that I can answer, let me know. I see patients tomorrow, so we'll probably be doing a video from the office, maybe around lunchtime. Monica, thanks for tuning in. I appreciate the feedback. And let me know what would help you guys, during this time. The goal, obviously, with a stress management boot camp is to work on our stress, but it's also to understand how our real and perceived stress are impacting our immune system during this time. So I want the doors to fly open on May 1st, and everybody runs out happier and healthier than they were when they locked us up however many weeks ago. Literally, I feel like I'm in prison. So let me know what we can do. I may start watching Prison Break or Alcatraz or what's the Andy Dufresne one? That's going to be on my watch list next. So You guys have a wonderful evening. As always, I love you. I appreciate you for tuning in. And share the group, because again, you never know who's not okay and who could use some of this information. And if you have hints and tips, please share within the group as well, because this is for you, to learn, support each other, and to get through this together. So love you. Have a wonderful night. I will see you tomorrow.